Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Police, thank you for joining us. Today we have Dr. Sara Police. Dr. Police is an assistant professor at the University of Kentucky. She has her PhD in nutritional sciences. And we want to talk specifically about what vitamins and nutrients and minerals are going to be important for immune function. We do want to be very honest and upfront about there's no FDA-approved treatments for coronavirus, the SARS-CoV-2 virus. There's nothing that we talk about today is going to guarantee you don't get it. But there's never a bad time to focus on immunity and just eating more healthier. So let's talk specifically, let's start by talking about some specific vitamins that may be important for immunity.
Right, so vitamin A, vitamin D comes to mind. Vitamin C, of course, with that, which I'm sure a lot of our viewers are more familiar with, and then zinc.
Okay, so vitamin A, let's start there. Tell me about vitamin A, why it's important, and how people can get more of that in their diet.
So vitamin A is a fat-soluble vitamin. So that's something important to remember because it's incorporated in chylomicrons after we eat, which are lipid droplets that then allow lipid absorption. So this is something to keep in mind because you need to have some fat with your meal to even absorb vitamin A. Okay, so why is it important from an immune perspective? We know that vitamin A deficiency is associated with increased mortality as it relates to intestinal and respiratory infections. We also know that supplementation has helped reduce morbidity and mortality as it relates to other viral diseases such as measles and malaria. How does it work? Right, so it helps inhibit aspects of viral replication.
Okay.
Right.
And you said in respiratory illnesses, so that's pertinent. You also talked about other viruses, so it may be helpful. But you mentioned deficiency, you're at higher risk. Is there any evidence that getting extra vitamin A, if you already have enough, is going to help at all?
No.
So probably from foods, we can probably get enough vitamin A. Let's talk about which foods are high in vitamin A, what people can do to get adequate amounts.
So there's a couple different forms of vitamin A, right? There's preformed vitamin A, and that's going to be in your meat sources. So liver, cod liver oil, eggs, dairy products, and fish. Pretty decent sources of preformed vitamin A. Provitamin A, carotenoid beta-carotene, that's your colorful vegetables. We think carrots, rich source of beta-carotene, colorful peppers, broccoli, spinach. Those are your provitamin A, colorful vegetables.
And that distinction is important because if you're a patient of ours, at least, you know there's a specific SNP, a polymorphism in the BCMO1 gene that you could have reduced function of conversion of the provitamin A, beta-carotene, into the active form. Sometimes that can be reduced by as much as 67%. So if you have that SNP, I generally encourage people to get more of the active form. And we talk about liver a lot of times, organ meats as being a really good source of vitamin A.
Yeah. A crazy high source of vitamin A, and not that we would go out and get this, is polar bear liver, right?
Yeah. That's the classic board question in medicine is bear. Yeah, I had a patient one time I was talking to about getting liver, and she specifically said, "Oh, we're going bear hunting," and I said, "Wait, You can actually get, that's kind of the one classic question, you get toxicity from vitamin A.
Exactly.
And I don't think she was hunting polar bears though, so
Right.
I'm not sure how it's different than other types of bears. So we want the active form if possible, but most people are going to, even the people with reduced function, BCMO, are going to still convert some beta carotene to the active form. So those are all great sources. Anything else about vitamin A, or should we talk about vitamin D?
One thing I wanted to mention about vitamin A, and I have some notes to help me write. So it helps inhibit measles replication by upregulating elements of the innate immune system in uninfected cells. Right, so imagine you've got your innate system cells, they're ready. It's like, hey guys, get ready for this. So it actually helps upregulate those protective mechanisms in innate cells that are not infected. So that's an innate mechanism for vitamin A.
Yeah, so colorful vegetables, organ meat, sardines. I talk about sardines all the time, but it's a whole fish. It's got the little organs in it. That's going to be a good source as well. What about vitamin D? We know there's research, if you're deficient in vitamin D, your immune system can be suppressed and you're a little higher risk. Tell me about vitamin D in general.
Right, so vitamin D functions as both a nutrient and a hormone, right? And we know we can get vitamin D from the sun, and our body synthesizes it thanks to the sun. Here in Kentucky, it's middle of March, end of winter. And we know that even in a healthy population, people can be vitamin D insufficient. Right, so I'm really hoping with increased sun and increased vitamin D, we'll see some changes. Vitamin D supports innate immunity support via toll receptors 1 and 2 to increase just natural antimicrobial and antiviral properties, like cathelicidins, for example. From the adaptive immune standpoint, we see it action in dendritic and in T cells to increase production of IL-10, for example, which is that friendly cytokine. So we want more IL-10 on hand.
Yeah, the hormone part is important too. We have men sometimes who have low testosterone, and I think it's a big mistake to supplement with testosterone without first making sure vitamin D levels are adequate. We've seen some pretty good rises in just testosterone just by correcting guys' vitamin D levels. It's a really important nutrient in general for more than just immune, but immunity is what we're talking about right now. There are also specific SNPs for being deficient in vitamin D, but this is one where the genetics in my mind are less important because you can measure this directly. So if you know what your vitamin D level is, make sure it's at least above 30, above 50 we would consider optimal. What if someone has adequate levels? What do you think about increasing? And the reason I ask is because I've seen some suggestion that potentially megadoses of vitamin D when someone has an illness can be protective or helpful. Do you have any opinions on that? There's not really good data on it.
There's not good data on it that I know of too, but I've also heard similar recommendations to increase that megadose vitamin D with some chronic conditions. Yeah.
So make sure you're not deficient at least.
Right.
There could be an upside to bigger doses, but kind of unclear evidence right now. Let's talk about food sources of vitamin D.
Okay. Food sources for vitamin D. So first I want to say there are a lot of foods that are fortified with vitamin D. Right, orange juice is fortified with vitamin D. Some cereals are fortified with vitamin D. So we do have fortification working for us in vitamin D.
Orange juice and cereals.
No, I'm not.
I know.
Cod liver oil, sardines, fatty fish, beef liver, again, and eggs, specifically egg yolks. Right, really rich source of vitamin D. That's one of my favorite things to recommend for people when they say what's a good source of vitamin D. Like, go for the eggs, but eat the yolk. Right. Yeah.
And then for vegans and vegetarians, what do you think? When I have a vegan patient, a lot of times I'll talk about mushrooms because of the vitamin D.
Right.
Are there any other great sources of vitamin D?
So put the mushrooms in the sunshine.
Exactly.
Right? Yeah. Because fascinatingly, vitamin D can content can be increased from that exposure to the sunlight in mushrooms. Yeah. Right. So beans, legumes.
Okay, great. Yeah, mushrooms, people that know me know I'm a mushroom fanatic. I'm drinking mushroom coffee right now. But it's fascinating. The mushroom genome, this fungus, is closer to an animal than a plant, really. So it's a really cool. It has a lot of just immune boosting properties of their own, maitake, chaga, reishi, all these others. So mushrooms are going to be a great thing to eat more of right now. Somebody can can get it. So vitamin C. Tell me about vitamin C.
Right. So a little back history of vitamin C. Linus Pauling, who was a 2-time Nobel Prize winner, is actually the reason I think that a lot of people say double up on that vitamin C for colds. And at the time, actually in the 1970s, he also thought that heavy doses of vitamin C would help with cancer and cardiovascular disease. So those large, more bold claims have been put to the wayside, but we still tend to reach for the extra vitamin C at this season. And for good reason. It does have antioxidant properties. And there has been a lot of studies to look at vitamin C as it relates to cold, flu, and the sniffles, right? And so in one meta-analysis, we know, I think it was published in 2014. It looked at about 14 different studies. It can shorten the duration of a cold by about a day, right? So modest benefit there. As to whether or not it actually can halt, I'm talking about supplementation, by the way, like over and above your recommended dietary, recommendation. That it's not really going to prevent the incidence per se. Now, this is a vitamin that a lot of people are interested in around the COVID-19 crisis, and there's actually a clinical trial underway to look at whether a megadose of vitamin C infusion in patients that are under in ventilation in the ICU and being treated for, whether this can help their outcome.
Yeah.
So that's being investigated currently.
Yeah, there was a 2019 study, the Citrus Ali study, multi-centered trial looking at IV vitamin C and sepsis. And it did show a mortality benefit. Now, there's a lot of discussion around that, and there's some problems with that study. But I'm glad someone's investigating this specifically for the SARS-CoV-2 virus. I'm not recommending this, but this morning I took 5 grams of vitamin C. In my mind, it's a low-risk thing, very inexpensive as well, and there's enough evidence floating around or suggestion that it could be helpful. And a lot of times people, I think, get confused. They will see studies and they measure an endpoint like mortality. That's hard to prove. And the kind of getting better one day, people say, well, that's not really enough of a reason to take it. But we're in a situation right now where we talk about flattening the curve, where one day less of an illness makes a big difference. If you can prevent someone from going to mild to moderate and needing some sort of hospital intervention, or moderate to severe and needing a ventilator or the ICU, that's a massive difference. And I'm not saying that vitamin C would do that, but I'm also saying it probably wouldn't be harmful. And hopefully we'll get some good data on the actual benefits for this specific virus soon. It's
in the recruitment phase right now. So and this study is based in China, so I'm looking forward to see what happens. Kind of a note of maybe a word of caution for parents that might be watching. Really high intakes of vitamin C can cause diarrhea. So if you start supplementing your child's diet and throwing a lot of vitamin C that they're not, especially if they're not really accustomed to a vitamin C vitamin, it could cause some GI cramping and diarrhea, so be careful with that too.
Yeah, when I have patients that get sick with a virus and they ask me if they can increase their vitamin C, a lot of big proponents of vitamin C, when they ask about dosing, they talk about basically there's not an upper limit orally that you can take that's going to hurt you, but it's take it to bowel tolerance, which means once you start messing your pants, then you've had too much
you've had enough.
vitamin C, so that can happen. Usually that's what I find most people, they can tolerate 10 grams or more, which is a lot, but not necessarily at all times. So if you really believed in this and you liked the research on it, you could put a pocket full of 1 gram vitamin C's in your pocket and just kind of take them throughout the day and get a large dose if you thought that was beneficial. And you have a little more bowel tolerance if you spread it out.
If you have that, yes.
Yeah. What about, so one we already talked about on the podcast, but I'd love to hear your thoughts on our zinc.
I'm excited about this. Not from the state potentially of supplementation, but for what it can do in the cell once it can get in there, right? Because it's been shown to slow viral replication once we can get it in the cell membrane. Generally speaking, from nutritional sciences standpoint, what does zinc do, right? So it's
and we know that if you're deficient in zinc, you definitely are a little higher risk of getting colds and viruses. Do you know why that is? Can you tell me why?
Zinc is a really important transcription factor for so many genes. those genes' role in an immune capacity aren't really well studied. So the fact that that zinc is a transcription factor for this, I think that is associated with your question as to why deficiency could be.
So we could have multiple kind of immune benefits, probably, yeah. And then specific to this, you're saying it actually decreases viral replication if you can get it into the cell.
Exactly, right.
Which we've talked about this on a previous podcast. Chloroquine, it looks like potentially could be a zinc ionophore transporter into the cell. So it's something that's being investigated. Again, no FDA-approved treatments, but the combination of those two is a really promising thing potentially.
Right. Is it helpful to supplement beyond and above the RDA for zinc? I'm not sure we have enough data to really say that. And I like the analogy that a car full of gas doesn't really drive faster.
Yeah.
Right? It depends on the location of that zinc and what it's doing. But certainly we want to optimize nutrition levels.
Right. Yeah. And you would think that having higher levels in the serum would probably promote a little more intracellular. Maybe we just don't know.
Yeah.
So we didn't talk about foods with vitamin C. So let's talk about foods for both vitamin C and zinc. What about vitamin C? What foods should people focus on?
So a lot of people go right to citrus. I like to say broccoli.
Yeah.
There's so much vitamin C in broccoli, right? Just loads more than in one serving of citrus. So broccoli for one, and then your citrus fruits two are a great source. Leafy greens, another great source of vitamin C.
Let's put that in perspective though, because how much vitamin C, and if you don't know, I'm going to look it up right now as we're talking, is in broccoli or citrus. Because the reason why I'm asking is because I feel like when I've looked this up before, it's not been anywhere close to the supplementation levels. So you couldn't really eat it. And I just looked it up here. So in broccoli, for example, a normal serving is 132 milligrams. So you would need about 8 servings of broccoli for 1 gram, which I said I took 5 grams. So I kind of took 40 servings worth of broccoli and vitamin C. So I think the foods, let's look up an orange. And if you're watching this, you probably Google it just as quickly as I could. But in an orange, so 1 orange has 51 milligrams.
Exactly.
So 1 gram is 20 oranges. So I had the equivalent, how much, I said 5 grams, so 100, I had the equivalent of 100 oranges this morning of vitamin C. So food, citrus, broccoli, is going to help you from being deficient. You're not going to get scurvy.
No.
But you're not going to get the supplementation levels that Linus Pauling talks about when he talks about 20 grams IV, then that's equivalent to 400 oranges. So it's a very different thing. Now, at the same time, we do think with foods, there's probably a little bit different absorption because they're with other things and cofactors and potential other ways to absorb it. But I just want to make that point that you're not going to get the mega doses by eating a lot of citrus and broccoli.
No, you wouldn't get the mega doses. That's true. And if memory serves me correct, the RDA is about 60 milligrams. So we're really, supplementing like those mega doses that are several times.
Because it's a very different thing to prevent scurvy and to
Exactly.
have the effects that Linus Pauling or others are talking about. And then zinc. For me, normally I recommend meat. That's one of the best sources of zinc. But zinc is an easy one to supplement as well. And if you're a vegan or vegetarian or you want something other than meat, just Google real quick on your phone, good sources of zinc as well, and you'll find several others. We've been talking about micronutrients and vitamins specifically. What about macronutrients? Is there anything people would do differently with protein, fats, carbohydrates than they would do normally?
So I haven't seen anything about carbohydrates or fats just yet, but I wanted to encourage everyone just to have healthy choices in those macronutrient groups, right? But protein is something that I've seen and just in emerging data around COVID-19. And so when patients are admitted and they test positive, there's a nutrition score that's done after a nutrition assessment. And patients that have higher scores, meaning they are more at risk as it relates to nutrition status, are given nutrition extra protein support immediately, right? Lower at risk, they're still encouraged to eat high protein foods, but those at higher risk are given like nutrition supplement immediately. So I think that protein status has a role in outcomes based on that.
So let me get specific about that, because the first thing that comes to my mind is the difference in deficiency and really pushing that. So I can understand how if someone was deficient in protein, maybe that would make a difference. At the same time, in general, I don't think, the way I think about macronutrients is fat and carbohydrates as fuel and protein as a building block. And I don't really encourage people to eat a lot of protein as the fuel necessarily normally, because it's kind of a little bit of a dirty fuel. Is this a case where pushing the protein a little more, you think the benefits outweigh the risks, or we just need to not be deficient?
Yeah, not as a preventative strategy, right? I think we just need to not be deficient.
Okay.
Exactly.
So maybe if you're a vegan or vegetarian, push, because those are the people that are most at risk of being protein deficient, maybe push vegan sources of protein a little more.
Yeah, be cognizant of that, right? And then especially for groups of people that are more at risk, right? Be cognizant of your protein intake. Make sure you have all your essential amino acids and what you're taking in. And you already mentioned the folks with dietary patterns that might be outside that.
Great. So standard American, eating plenty of meat and eggs and things like that, probably don't worry about it. If you're really vegan or vegetarian, just be cognizant of it.
Exactly.
Great. That's super helpful.
If there was ever a time to eat a balanced diet and try a vegetable that you haven't tried, I think it's now, right? And I'm a whole foods proponent because broccoli, for example, brings so many other health benefits to the table, right? Not just vitamin C like we were talking about, but also fiber, B vitamins, phytosterols, which are compounds in food. And this is what I love about nutrition, right? There's compounds in food that don't really bring energy to the table, right? We're not talking about caloric benefit or a macronutrient benefit, but they're unseen benefits that prevent that are antioxidant. So they prevent oxidative stress and work to boost health in different ways. And so some of these unseen heroes, I think, maybe could be important as we move forward. And I'm thinking about phytosterols like quercetin, resveratrol, and some of these that have shown some antiviral properties in other studies before we ever knew that COVID-19 would be existent, right? We know that these phytosterols have antioxidant and antiviral properties.
Yeah, quercetin has been shown to be helpful against Ebola, several other viruses like that. I saw 4 studies out of Italy related to quercetin and its antiviral. There's a group out of Montreal studying that right now, and that's one of the things I'm highest on is quercetin itself. And that's a great point you make about, I guess, kind of the entourage effect of these things coming together in whole foods as well. I think it's a mistake a lot of times when we have a reductionist view of foods and we talk about the specific vitamins. Right. We do have research and we know specific ones are important, but I think it's a mistake to think we're smarter than nature a lot of times. And I totally agree, whole foods. And that brings up another good point. Right now, a lot of people are thinking about how they can support their neighbor in times like this as well. And we at least are very fortunate here in Kentucky. We have great farms and farmers around. Right. I got an email this morning from a gentleman who delivers food from his farm, and he actually forages wild food. And he's not selling to any restaurants because no one's going. Right. So I told him to bring all the food he had by the office, and we would take it for our clinical staff. And that's a way, if you can reach out to your local farmers, that you could actually support farms in your area and get really good nutrition for your family. Because even restaurants and drive-thrus that are open, personally, I'm not, I don't want to say anything to hurt restaurants, but support your local farmers. I think that's a good, safe option. It's going to be a very healthy option for you. And it's a good time to kind of come together in that way.
Definitely.
What about research going forward? Is there anything else that you're seeing coming out that you're excited about?
I'm wondering about the microbiome and supporting the microbiome because it's so important to immune function, right? And so increasing diversity of foods that we're eating helps support the diversity and function of the microbiome. And I was looking last night and this morning, and of course it's just so soon. It's too soon to know how the microbiome or tweaking the microbiome could have any impact in this, but I'm pretty excited about that possibility.
Yeah, and you're our go-to expert on the microbiome. You were planning on giving a talk about microbiome with the Wild Health Summit. We're still going to do that virtually, but we'll also release that for everybody to see if you can't make the summit. So yeah, that's great. I'm really interested to hear your thoughts on the microbiome, and maybe we'll talk about that even before the summit if you have time again, because I don't think is there any data. There's not really any data on right now, but
none
okay.
That I could find this morning. There might be that I just couldn't locate it. Right.
So we'll keep watching that. So I really appreciate you coming on. What I'd like to do is encourage anyone that's watching this to write down some questions, send them to our Instagram, and we'll ask Dr. Police those questions again and maybe have you back if you've got more time.
Okay.
All right.
Sounds
Thanks
good.
so much.
Thanks.
Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.